In the early months of the COVID-19 pandemic, hospitals across the US faced an unprecedented crisis. Patient beds were rapidly filling up, healthcare workers were stretched thin, and the risk of hospital-acquired infections was soaring. Amid this chaos, the Hospital at Home waiver program, initiated by the Centers for Medicare and Medicaid Services (CMS), emerged as a bold new approach to healthcare. It allowed hospitals to provide acute care directly in the patient's home, while still receiving Medicare reimbursements. This shift was more than just a temporary fix, it was the start of a revolutionary new model for healthcare delivery. A new landscape in healthcare. By Q3 2023, the HA program had expanded to an impressive 365 approved CCNs, CMS certification numbers, spanning 138 health systems in 39 states. Health systems that had long been viewed as giants of innovation, like Mass General Brigham, Mayo Clinic, and Mount Sinai Health System, were early adopters of the model. They showcased HA's potential to enhance patient care, reduce costs, and alleviate strain on traditional hospital infrastructure. This model fundamentally redefined what healthcare could look like. Instead of patients being tethered to a hospital bed, they could now recover in the comfort of their own homes, surrounded by family and familiar surroundings. For hospitals, the benefits were clear: reduced hospitalizations, fewer unnecessary tests, and lower costs associated with traditional inpatient care. It was a win-win for both patients and healthcare providers. Key drivers of Hospital at Home adoption. The HA model's success can be attributed to four major factors. 1. Patient-centered care. At the heart of the HA program is the belief that patients recover better in familiar environments. By receiving care at home, patients experience less stress, have improved mental health, and in many cases, recover faster. Families can remain close to their loved ones, and patients can avoid the loneliness often associated with prolonged hospital stays. This personal connection and comfort are powerful drivers of the model's success. Studies consistently show that patients overwhelmingly prefer to recover at home rather than endure extended hospital stays. 2. Cost effectiveness. The HA model also brings considerable cost savings. A study from 2019 found that hospitals using this model saw a 38% reduction in healthcare costs. This was due to fewer lab tests, imaging studies, and specialty consultations, elements that often drive up the cost of traditional hospital care. The savings allowed hospitals to allocate their resources more efficiently, while simultaneously reducing the risk of hospital-acquired infections, which further drove down costs. 3. Technology integration. A key enabler of HA is remote patient monitoring, RPM. Through wearable devices, healthcare providers can continuously track patients' vital signs, ensuring that any medical concerns are quickly addressed. This technology, backed by AI-driven analytics, allows doctors to monitor patients remotely with confidence. Virtual check-ins and telemedicine visits ensure that patients are never truly isolated, even as they remain at home. This seamless blend of human care and technology allows HA to deliver hospital-level care in a home setting. 4. Scalability and flexibility. During times of crisis, such as the COVID-19 pandemic, hospitals were forced to think creatively about how to manage bed shortages. The HA model provided a scalable solution, allowing hospitals to expand their capacity without needing to build new facilities. HA has proven to be a versatile tool for managing patient care during times of high demand. As healthcare continues to face challenges with resource constraints, HA will likely remain a key solution for expanding care capacity. Hospital categories in the HA program. The hospitals participating in the CMS Acute Hospital Care at Home program can be divided into several categories, each contributing to the program's growth in unique ways. Academic medical centers like Massachusetts General Hospital and Stanford Healthcare are often at the forefront of medical innovation. These institutions have used their expertise in research and teaching to successfully integrate HA, leveraging telemedicine and advanced monitoring technologies. Community hospitals such as Mercy Hospital South, MO, and Prisma Health Oconee Memorial, SC, have adopted HA to bring high-quality care to local populations. These smaller hospitals play a vital role in extending HA to underserved areas. Health systems, including major players like Cleveland Clinic and Atrium Health, have used HA to serve diverse patient populations across state lines. These systems are ideal for scaling HA, offering a blueprint for how the model can work across different regions. Specialty hospitals focus on treating specific conditions. Institutions like Mayo Clinic, Arizona have found HA particularly effective for managing chronic conditions at home, allowing patients to receive specialized care without the need for hospitalization. Rural, regional hospitals such as Claiborne Memorial Medical Center, LA, have integrated HAR to ensure that patients in remote areas receive acute care, helping to close the healthcare gap in underserved regions. The future of hospital at home as of Q3 2023, the CMS waiver allowing hospitals to receive Medicare reimbursements for HAR services is set to expire at the end of 2024. Although policymakers are working to extend the program for another 5 years, the long-term future of HAR remains uncertain. If the waiver is not extended, hospitals may face challenges in continuing to offer home-based acute care. However, if made permanent, HAR could significantly reshape the US healthcare landscape. The potential for providing high-quality, cost-effective care to patients in their homes, particularly in rural and underserved communities, is immense. But there are challenges to overcome. Interoperability. For HAR to work at scale, healthcare systems must ensure that electronic health records, RPM technologies, and telemedicine platforms are fully integrated. Seamless communication between different systems is essential to the program's success. Regulatory compliance. As HAR expands, hospitals must navigate a complex web of state and federal regulations. Ensuring compliance will be critical to maintaining the program's sustainability. Rural access. While urban areas have seen rapid HAR adoption, rural areas still face barriers, such as limited broadband access, that make it difficult to implement RPM and telemedicine. Bridging this gap will be a key challenge for expanding the program. A glimpse into the future of healthcare. The Hospital at Home Waiver program has proven that acute care can be delivered safely and effectively outside traditional hospital settings. As technology advances and patient preferences shift toward more personalized care, the hospital at home model represents a powerful vision for the future of healthcare. Whether it becomes a permanent fixture in the US healthcare system will depend on overcoming regulatory, technological, and infrastructure challenges. If successful, the hospital at home model will redefine how we think about hospital care, moving it from the sterile confines of a hospital room to the warmth of a patient's home.